Tonight's interview is with Dr. Nakiya Showell, and she is here in person. So thank you so much for being here. She is a doctor of medicine and has a master's of health science and a master's in public health. Dr. Showell is an assistant professor of pediatrics at Johns Hopkins University School of Medicine, and she's also board certified general pediatrician and attending physician at the Johns Hopkins Harriet Lane Clinic. And then recently she became the associate medical director at the Harriet Lane Clinic. So congratulations. She also serves on the Pediatric Diversity Council and on the intern selection committee for the Johns Hopkins Pediatric Residency Program. So thank you so much for being here tonight. You are a very, very busy person, so thank you for taking some time out of your schedule.
My pleasure.
Let's sort of jump in. And my first question for you is really just what is it like? Can you tell us just a little bit about what you do?
Sure. So firstly, thank you so much for joining me today. It is so great to be able to talk to more families and more kids. My everyday life, it changes from day to day, but in general, I work with young folks like yourself and families every day. Depending on my schedule, I see patients in clinic, and I also do research on childhood obesity and specifically programs to help prevent childhood obesity for younger kids in the preschool age range. I also teach. Have some teaching responsibilities for medical students and also trainees for doctors who are learning to become pediatricians, what we call residents or interns. And outside of that, I also am heavy into community service. So outside of my everyday job, I'm also very active in my community and serving programs and doing mentoring programs and other speaking arrangements in the local Baltimore area community. So my day varies from day to day, but in general, I'm doing a little bit of everything, if that makes sense. And all in all, it's my entire focus is focused on promoting the health and well-being of kids and families, and whether it's community service or whether it's working in clinic or whether it's doing research, whether it's teaching other younger doctors how to be pediatricians or medical students and becoming doctors. It's all with that focus in mind.
So it sounds like you are doing lots of different things. Do you have an average day? And if so, what does that look like? Or maybe what does an average week look like?
So it depends on my schedule, but in general, I'm seeing patients maybe 3 or 4 different times a week. And outside of that, I have some duties as the medical director of the clinic. So that would involve participating in meetings with with the other medical directors and other leaders to make sure the clinic is running smoothly. And it also involves, having some time set aside to prepare for those meetings and time set aside to write on different things to be able to support the programs and research that I do. So as part of my job, I also write a lot and have to convince funders and other entities to be able to support the work that I love to do. So that's another big part of my job as well. And then once the research is done, we have to be able to share what we found in the research in journal articles. So that's another part of what I do is writing what I've done and being able to submit those to publish and be able to share those with other people. So again,
I wonder if
I'm sorry. Go ahead.
Yeah, no, I wonder if, or at least I might be a little bit, I'm surprised, how much writing that you're actually doing. Because I think so often people think about STEM careers and think, oh, this is a math and science. Yes, we do some writing, but, oh, writing's for those English majors. But the importance of writing and needing to be a good writer. And it sounds like not only are you doing scientific writing, so doing writing for journals, but also for grants and funding, you need to learn that type of writing as well, which is totally different.
Absolutely. And I think when I was thinking about being a doctor, I didn't think about the importance of writing and that I would be doing this kind of writing. I thought I would be doing, the writing needed necessary to do English papers in college,
right?
And so forth. But I actually didn't think about a career in research or a career involving grant writing until much later, until
Mhm.
after I'd become a doctor.
Mhm.
So I think it's important to have perspectives from different types of doctors, because not all doctors do the same thing. Even pediatricians, not all of us are, only seeing patients. Some of us are doing different things, writing and teaching,
Mhm.
and other administrative duties. But I would not have expected, that my career would involve what it does now.
Yeah, definitely. Do you feel like you were naturally a good writer, or did you sort of pick it up as you went along?
That's a great question. I think I think my mom forced me to become a good, a good writer, because she had the foresight, more so than I did, obviously, as a kid, that regardless of what career I went into, I needed to have a solid foundation as a writer.
Mm.
My mom was an attorney. She wrote a lot for her job. And I knew that I didn't want to be an attorney. And for some reason, I thought that it was because it was a lot of reading involved. But then I realized later that medicine also involves a lot of reading. But the writing piece, I think that was something that she really pushed me to have a solid foundation in.
Uh-huh.
And this was even before I decided to go into medicine. And it wasn't even, it wasn't even just writing about science, which I loved to do when I was younger, but it was being able to express myself and express how I feel, creative writing, and also biographic writing, and also scientific writing. To be able to have skills in all different types of writing was something that she definitely reinforced. And also the teachers and professors that I had, also they pushed me to be a good writer. And I think it's important to have that skill set regardless if you go into medicine or not.
Yeah, yeah, that's true.
Mhm.
So let's talk about some of the fun stuff. What's your favorite part of your job?
Seeing babies. I love all my patients, but and I see patients up to 22, so much, not just younger kiddos, but also adolescents and young adults.
Uh-huh.
But I love seeing babies, and seeing babies over in multiple visits, because you can see them grow and develop and just see how they change over time. It was a big part of why I wanted to go into pediatrics, because, and particularly be a general pediatrician and work in an outpatient clinic where I can see families or multiple visits. And,
Mhm.
and sometimes very frequently, like every 2 months. In that first year of life, you see the doctor. When you're a baby, you see the doctor pretty regularly for the first couple years of life. And I just love the idea of seeing someone as a newborn, and then seeing them 2 months later and 4 months later and 6 months later, and they're like so totally different. And they do so many different things. It's amazing. And it still amazes me to this day, when I see patients that I've known for 6 and 9 years, and being at the same place for this period of time, and the developmental changes and changes in life. It's really great to be a part of that as a pediatrician. You feel part of the family, and you feel like you have this great relationship. And I really pride myself in having like great relationships with the patients and families that I serve. It's the best part. I love relationship building.
Mhm. Yeah, definitely. So what about the hardest part? What's the hardest part of your job?
Yes, there is a hardest. There are hard parts, and I think the biggest thing, I think particularly during this year, is the time. So probably the definitely the hardest part is just being able to balance what's needed of you as a doctor with what's needed of you as a person outside of work, right? So doctors have lives too, and we like to do fun things both at work and outside of work, and you have to balance your other priorities. And leading up to this, I knew that I was in for a long journey, invested a lot of time and training. And I wanted to be able to, pursue and be able to have the kind of career that really was very fulfilling, which it is for me, but also be able to live life outside of work as well. And I think the hardest part is just the hours that are sometimes necessary to get things done. Some weeks are long, and that's just part of the job. Sometimes I'm at clinic for long hours. Sometimes I'm in my office or even doing work at home for longer hours. Sometimes I work on the weekends. Not every weekend, but sometimes I have to. And
Mhm.
sometimes I have to work after 5 and 6 o'clock at night, sometimes well into the evenings. But I do it because this is the one thing that, this is the only thing I can see myself doing as a professional, and it gives me joy. But it can be hard sometimes, and I won't minimize that. And I think it's helpful. I knew that as a younger person, doctors told me that this is going to take hard work, and I think it's great to be honest and understand some of the expectations involved with this kind of career. And especially when you're a general pediatrician who also does some other things outside of patient care, like I mentioned, research and teaching and helping to operate a clinic. There are other responsibilities that you have, so you have to balance all of that.
Mhm.
Mm.
How did you choose to be a pediatrician? And specifically too, not only did you choose to go into pediatrics, but then you were interested in research, or you're doing research, and then you're also really interested in obesity in children. So how did you make those decisions? Was that a hard decision? And then thinking about, kids who want to be doctors, what would you how do they go about that process of deciding what they want to do?
Yeah, so for me, it was probably about, I guess I was about 11 or 12, so the ages of some of the kids on that are joining us this evening in middle school. And I knew that I love science. I love biology. It was probably my favorite subject, and I loved figuring things out.
Mhm.
I was not happy until I could figure out, what this puzzle, I figure out this puzzle or figure out this riddle. I like to figure things out on my own, and I was very hands on. And I knew that I did not want to be an attorney. After I thought I did when I was very young, because my mom was, and then I realized she read a lot, and then I realized I needed to read a lot later on too. But I think my love of science and coupling that with my desire to build relationships with people and to interact with people and to help people, I was very heavily involved in community service, and I tried to figure out a career that could blend my interest in science and helping other people, and it was a natural fit. Pediatrics came about. I actually had the idea to be a pediatrician probably before I went to college, and that was because, so two things happened. So at 14, my twin brother and sister were born. So I had, as a 14-year-old, as a teenager, I had experience with seeing babies grow up right in my own home and helping to take care of them. And I thought it was amazing. I thought it was amazing how, babies could grow up, and how, and the importance of a pediatrician or a family doctor in helping them, be healthy. And I also have fantastic pediatricians. I went to an all-female pediatric practice, and I thought all pediatricians were female. So I thought it was the coolest thing. I was like, well, pediatrics is for me because I'm a young woman, and all pediatricians are women, and and the pediatricians and the staff. So this is it. And I thought we could own our own practices. I can own my own practice with other women, and that's what I thought. I really had this image in high school, like, okay, this is great. And while pediatrics is, there are a lot of females. It's a female dominated field. At certain levels, there's definitely a lot of male pediatricians. So it's not it's not just females in pediatrics, but they inspired me. My own pediatricians inspired me, and my experience with my brother and sister. So I had an idea that pediatrics was a possibility. And then once I got into medical school, did my different rotations, I liked a lot of different things, but the rotations I liked the best were the rotations that I worked with kids and families, and particularly in outpatient clinics. So I even had a sense that I wanted to be a doctor that worked in the general pediatric clinic, even as early as medical school. And that solidified it for me. And I applied to pediatric residency, and that started my journey to where I am. As far as what it entails to become a pediatrician, as I mentioned, there's definitely a significant number of years in training required to be a doctor. But they go by really, really fast. I will tell you that. College I thought was fast, but medical school is even faster because you're doing a lot of work, great work, you're learning, and those 4 years after college, they zoom by. So after college, 4 years, medical school, 4 years, and then you need to pick which field you want to go into. And for me, that was pediatrics, and that was a residency program to train to become a pediatrician, and that was another 3 years. I did not know then that I wanted to be a researcher or that I wanted to focus on, having some administrative and teaching duties. It was not until I did my master's in public health, after I finished my residency, that I realized that I wanted to think about problems a little differently. And I wanted to be able to have the skills to try to figure out some of the biggest problems that we face in this country and abroad. And childhood obesity is one of those problems that I wanted to tackle. And I wanted to do something about it. I wanted to see patients, but I also wanted to be behind, some of the changes that are necessary to make, change on a more broader, bigger level. And I thought research was the way to do it, and to be able to and change how we do things as practitioners, and also how we do things as policymakers, to really change the environments and school environments and places where people live. Those were all things that I was so interested in, and trying to figure out and trying to address. And I really did not think, I had not thought about a research career until, I got more outside of my primary training, and then, landed here. And 10 years ago, I definitely would not have imagined having such a diverse career, as I do now. But it was really just being open-minded to the different possibilities and listening to mentors along the way and guides. And I think that was really important. So you have to definitely be open-minded, because what you think you may want to do may not necessarily be what you end up doing. And that's totally fine. That's totally okay. I think that was one of the biggest pieces of advice that my mom gave me, is just kind of go with the flow. Sometime you need to have goals, but it's okay to take this kind of path and not like straight. And that's okay. Everybody has their own path.
Yeah, yeah, that's good advice. So we've talked a little bit about writing that's involved, and you just spoke about being open-minded. Are there other skills that lead to you being successful in your career?
Yes. So I think you have to be relatively organized, which I pride myself in being, but you do. I think if you have a career which is diverse, and when I say diverse, I mean that there's different parts of your career, outside of patient care. You have to be relatively organized, and you have to be able to pivot, I think, relatively easily from one thing to another thing. And I think what also has brought me a lot of success is that I'm very collaborative, and I like to work with other people. You have to be willing to work with other people, and not just working with the families and patients that you see in clinic, but other people that are your colleagues, and other people who work with you, other staff members. You definitely have to be open to building those kind of relationships. And that's a really important part of what I do. And that's really helped me to be successful up until this point. And even though you're open-minded, you still have to set goals and try to stick to those goals, because it's easy to get swayed to do one thing, and there's a lot of things going on, particularly in this world today. And if you don't have your goals, sometimes I have to write those down just to have a reminder. You have to be pretty diligent in trying to, reassess, like, what's my progress? Have I done this? Have I taken this class? Next week, I'm supposed to have this done. So even if it's making check boxes, having some kind of system to remind yourself of what your progress is with regards to the goals that you set for yourself. And your goal could be, at this point, could be just, let me explore if this is for me. Let me just shadow a doctor. Even as young as 11 and 12, I knew that I had to put some things in place to be able to prepare myself, and that means setting some kind of goals, even as young as 11 and 12, or even younger, of where you want to be.
Yeah, yeah, that makes sense. Goals are definitely helpful. Um, Any final tips for kids who want to go into medicine? Whether that be like, oh, you got to take this class, or it's really helpful if you do this extracurricular, or even something more broad.
Yes. So I would say, write down a list of why you want to go into medicine. And it's something that I think I had in my head, but I never actually wrote down. And I'm sure I can write it down very easily. But I wish I had something to just keep me grounded, even in those earlier years. Because, like, as I mentioned, this is a really awesome career that I have, but it takes a lot of time, and money invested in be able to go down this path. So write down, make a list of the reasons why you want to become a doctor. And also be open to exploring other careers if this is not the career for you. Um, I had some role models in my family. I did not have immediate family members who were doctors, but I knew of persons that I wanted to at least have some experiences with to see if I, liked what they did on an everyday basis. And that's another suggestion. I know it's difficult during the present times to be able to have shadowing experiences, but it's great to be able to follow a doctor and see what they do every day.
Mhm.
And having conversations and dialogues like this, to see what their average day looks like is absolutely essential. As far as courses and preparation for training, it will be a difficult path if you don't have an affinity for science, I would say. If you absolutely don't like biology, anatomy, all of that doesn't sound like doesn't sound fun at all, this will be hard. It's not the science. It's not. I was not a fan of. I'm not a fan of math, but it was something that I was decent at.
Mhm.
And you have to know what you don't know, and you have to know what your strengths are, and also know what things that you need to work on,
Mhm.
and know that early, and really try to figure out what are the things I'm good at, and do I like working with other people? And that's a big question to ask yourself. Do I like building relationships? Do I like working with kids? Do I like working with families? Do I like working with older adults? Do I like working in teams?
Mhm.
Because that's essential as well. You're going to be working with other people during your entire training and during your career. You can choose to be by yourself, but it's going to be a hard path. So those are the questions you have to ask yourself early on.
Yeah, those are great questions. And I think helpful with any career, thinking about, set those goals, but be open-minded and think about, what do you really like to do? And maybe what do you not like to do?
Fine.
Well, thank you so much, Dr. Showell, for coming and speaking with us today and answering all of our questions about what it takes to be a doctor. And thank you so much for just taking the time out of your very busy schedule to be with us. So thank you again.
Thank you. Have a wonderful evening.
You too.